whether or not he's found to be guilty or innocent at the end of this trial.
Sadia, thank you very much for joining us this morning.
Now, here's the question. Do you think that your home and your car should be smoke-free zones? Now, if you think cigarette smoke doesn't affect your children, shocking new figures might make you change your mind.
Yeah, around 800 children a day visit their GP because of exposure to second-hand smoking, according to a campaign that launches today. We asked people if lighting up in a car or even at the back door should be outlawed.
The government has penalised people that smoke enough without telling you can't smoke in your car.
From a health and safety point of view, I'd say yes, but from a personal point of view, being a smoker myself, I'd say it's down to personal choice.
The parents should pay a fine for me, I think.
They should ban the smoking in cars with young kiddies in the cars.
If they want to damage their health and those around them, let them do it.
So just how much does it damage the health of others? In a Daybreak special investigation, Dr. Hillary has looked at the impact of smoking whilst doing a 10-minute school run.
Well, we're just about to set off on a mock school run. My chauffeur here will be driving and he'll be lighting up on the way. And this meter is a laser dust monitor which picks up particles that come from cigarette smoke. At the moment, we've got particles numbering 3,256 per litre of air that we breathe. We're going to compare that to what it is when we've been smoking. We're halfway through the school run. We've got the windows open and levels have hit 150,000. These particles are the smallest ones. They penetrate deep down into the tiny air sacs of a child's lung. The immune system also can't fight back as effectively as an adult can. Levels now over 250,000. So you can see, just with this simple test, how dangerous smoking in closed spaces like a car can be.
Well, joining us from his home is Dad of two, John Warner, who's trying to give up smoking. Good to see you this morning, John. You thought you were doing the right thing, didn't you? You're having the cigarette outside the back door. So how shocked are you by this latest information?
I'm very shocked indeed, to be honest. The fact that there's so many things that you can't see or smell that are happening after you've finished your cigarette and you can't smell the smoke or see it is quite scary.
And the fact that you could be damaging your children's lives. They've never been that keen on you smoking anyway, have they?
No, my kids hate the fact that I smoke, and they spurred me on to try and give up smoking.
And what about this latest information then? Do you think that will give you the added spur you need to give up?
Yeah, I think so. It's again, you have to think of your children when you're smoking, and it's very shocking.
Oh, John, we wish you all the best with your campaign to stop smoking, and thanks for joining us this morning. Good to talk to you.
Thank you, John. And we're joined now by pro-smoker David Atherton and Dr. Hillary. We saw John there. He was shocked by these statistics and very worried about it, wants to give up smoking, thought he was doing the right thing by smoking beside a window, and not at all. So the trouble with children is they don't actually have a choice, do they?
Well, I do take your point within that, but I think most parents in this country are very responsible in smoking outside or smoking in a different room for their children.
They are being responsible doing that, but the thing is, even by doing that, by winding the windows down, by standing outside, the children are still being affected by their smoking.
Can we get the harm of passive smoking into perspective? If you
800 kids a day are going to hospital, are going to the doctors.
Let me explain. If you're pushing your child down the high street in a pushchair, there's 5 cars coming one way, there's 5 cars coming the other way. It is the equivalent of being surrounded by 5,000 smokers. The amount of chemicals...
Dr. Hillary's looking at you and saying, I don't think that's right.
We're talking about different particles. I mean, the particles that you inhale from cigarette smoke are covered in toxins and chemicals, whereas diesel particulates are completely different. Larger particles, they don't get down to the small air sacs of the lung.
They do.
They don't. Not so much. Not nearly so much.
Amongst
but actually, that's something you can't do anything about necessarily. When you can't keep your kids in a bubble when you're wandering around. But you, as a parent, you can stop smoking in front of them.
Well, you can do. But what I'm saying is, the amount of carcinogens on the street from cars.
Yeah, but why add to it by smoking in front of your kids?
Because it's so relatively small in comparison.
Yeah, but that doesn't make it right.
And as I say, maybe parents should, within certain parameters, show some discretion in the house, open windows or even go outside.
Would you smoke in front of children?
I tended to smoke in the other room and smoke by a window.
So will you change now that you know that what the latest report says?
No, I won't, because
You won't?
No, because well, first of all, my kids are at adult age now.
Right.
They're 23 and 18 now. But the point is, this is part of the. Well, the state is actually now picking on smokers. We are now state sanctioned from the government to be disliked by everybody in this country.
But for good reason, though. They're trying to protect children and actually trying to protect smokers as well.
Well, if you want to protect children, don't take them down the high street or near cars.
That's totally inaccurate. In our test yesterday, we measured a background level of pollution in the air in a busy street. It was about 2,500 particles per litre of air breathed. When we got into the car and somebody smoked in the car, within 5 minutes, it was over 500,000 particles.
Wow.
I mean, you just cannot compare smoking to what's going on the street.
The British Medical Association also quoted a paper that was similar to that. And the British Medical Association was found guilty of exaggerating the effect.
I wasn't exaggerating. I did the test myself.
Right, OK. I actually read the paper from where the BMA got this information from. If the driver's window is down or all four windows are open down in the car, it has perfectly safe.
We had the windows down.
Yeah, we did.
I'm sorry, we did.
Surely this is all about protecting children. I mean, a baby sitting in the back of a car when people are smoking doesn't have a choice.
Nope.
You have a choice as an adult to smoke. That is totally up to you. I respect that. If you want to smoke, that's fine. I think you're crazy, but that's fine. But the thing is, the children don't have a choice at all, and we have to protect our kids. We've got massive responsibility to our children.
Well, the point is, the majority of parents in this country actually do that. There was a survey done of smoking in cars, and the vast majority of parents in this country don't smoke in their cars. And also, very quickly, there was a study done by University College Dublin Public Health. They looked at 2,230 cars, and only 9 people were exposed to second-hand smoke, and only 1 baby. It is not a social problem in this country.
The problem isn't just restricted to cars either. If you look at homes, you get two parents who smoke. A child or a baby in that household is smoking the equivalent of 80 cigarettes a year.
Right.
Yes.
Baby or child.
Okay.
So
thank you both.
Yeah.
Very
Thanks
much.
for joining us.
Love to know what you think. Do get in touch with us and let us know. Right, headlines for you this morning. The Queen will celebrate the 60th anniversary of her coronation today in a special service at Westminster Abbey. The Duke of Edinburgh, who pulled out of an engagement last night, is expected to be by her side.
The NHS is failing to meet targets to treat enough A&E patients within 4 hours. Waiting times in casualty units are now at a 9-year high.
We understand that Oscar Pistorius has actually arrived in court this morning. Not expected to be a long appearance in court.
So.
And actually, the trial perhaps later on this year.
Next year or next year.
Maybe next year.